Hi there, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and I want to thank you for being here and being a proactive parent and getting the resources that you need to help recover your own child from the symptoms of autism. And I provide natural resources to you and interview experts all the time on various subjects that can help you with a child with autism, because I too, like you, am a mom who once had a child that was diagnosed with autism, but today he no longer is. And that's because of the research that I did and the resources I found and I have implemented with my son. And then today he is fully recovered. So I like to be able to share those resources with you so that you can get your child to optimum recovery. And there are 4 stages that I can walk you through to really let you know what is really needed in autism recovery. So I've created a free online workshop for you called the 4 Stages to Naturally Recover from the Symptoms of Autism. And stage 1 is healing the gut. Stage 2 is natural heavy metal detoxification. Stage 3 is clearing the co-infections like mold, Lyme, and strep. And then stage 4 is brain support and repair. And you can get that free workshop webinar at naturallyrecoveringautism.com/free workshop. No spaces, just free workshop. So hopefully that's really helpful to you. And again, today we have yet another expert guest with us. And our subject today is going to be on hyperbaric oxygen chambers and their benefits for children with autism. And so we have with us Dr. Anju Usman Singh, and she is director and owner of True Health Medical Center and Pure Compounding Pharmacy in Naperville, Illinois. She specializes in biomedical interventions for children with ADD, autism, PANS or PANDAS, and Down syndrome and related disorders. She has been involved in research regarding copper and zinc imbalances, metallothionein dysfunction, biofilm-related infections, and hyperbaric oxygen therapy. She serves on the medical advisory boards for TACA, the Autism Community in Action, and Autism Hope Alliance, as well as serving on faculty for MAPS, which is Medical Academy for Pediatric Special Needs. Dr. Usman Singh received her medical degree from Indiana University and completed a residency in family practice at Cook County Hospital in Chicago, Illinois. She is board certified in family practice in integrative and holistic medicine. So, Dr. Singh, welcome and thank you so much for being here today. I greatly appreciate your time and your expertise to be here with us today.
Oh, thank you for having me.
So let's dive into hyperbaric oxygen chambers and basically maybe give some background. We might have listeners who've never heard of this before, so can maybe start from the ground up. And what is hyperbaric oxygen therapy? Can you go ahead and give some explanation behind it?
Yeah, I can. So, we all know what oxygen is, so that's kind of a given. And then the hyperbaric term comes from extra pressure. So it's oxygen under pressure. And hyperbaric therapy is just using a hyperbaric oxygen chamber to apply, get oxygen into our tissues under pressure. And so, some of the terminology is a little confusing because, as you mentioned, there's hyperbaric oxygen therapy, but there's also hyperbaric therapy. And as you mentioned in your intro, that I had done some research on hyperbaric therapy for children with autism. And so it's a little different than hyperbaric oxygen therapy.
And how do they differ?
One is oxygen under pressure, and so they're giving extra oxygen. So you're pumping oxygen into the chamber. So in most cases, when we talk about hyperbaric oxygen, they're pumping 100% oxygen into the chamber. And
so they're not doing this now.
Hyperbaric therapy is just room air oxygen under pressure.
So what are the different, I mean, why would somebody choose to do one over the other, and what are the benefits? And I know also we should address, a lot of parents ask me the differences between hard-sided chambers and soft-sided. So if we can, cover that at some point too, because I know that kind of rolls into these two things that we're talking about now.
Yeah. So that's exactly what we're talking about. So when we talk about regular room air, we're talking about the pressure at sea level. And so our oxygen at sea level is what we call 1.0 at 1.0 atmospheres of pressure. If we go up, say like if we're in Denver, there's less pressure. And so a lot of people feel lightheaded because then they get less oxygen. If we go below sea level and there's more pressure, and so when we use the terminology for hyperbaric, we talk about dives, that we're diving in a chamber because we're going kind of under the pressure of, where we're at sea level, we're going under sea level. And so that terminology, hard chamber, soft chamber, really comes into play when you're talking about pressure. So at at sea level, we're at 1.0 atmospheres of pressure. And in the soft chamber, it's 1.3 atmospheres. And in the hard chamber, it's 1.5 atmospheres of pressure. And with that higher pressure, you get more oxygen into the plasma of the body. So that's the whole point of hyperbarics. Hyperbarics is trying to oxygenate the body at a deeper level. So again, when we think of oxygen, we think of, it's vital for life. We need it. We would die without it. But what does oxygen really do for us? Basically, it helps us to burn our sugars and our fats to produce energy. So the oxygen is really helping us with energy. It's helping us utilize our food. It's helping our mitochondria. And this oxygen, again, just so we kind of think about it, it's transported through our lungs when we breathe onto hemoglobin and myoglobin, and then it's sent to our tissues, and then our tissue uses it for energy to make things and to construct things and to build collagen. So when we're talking about hyperbarics, remember we're talking about oxygen and we're talking about pressure.
Okay, so hyperbaric versus hyperbaric oxygen versus the hard chamber. So you've got 1.0 atmospheric pressure, 1.3, and then 1.5. So why would somebody choose one over another?
So there's this law called the Boyle's Law. So the Boyle's Law says that at constant temperature, there's an inverse relationship between pressure and volume. So the more pressure we have, the less volume we have, and we're able to saturate our plasma with more oxygen. So the increased pressure we have allows for more gas to be dissolved into our plasma, and then that oxygen can help feed our brain, crosses the blood-brain barrier. It helps, get oxygen into areas and tissues that could use healing, like our joints and our muscles. So that extra pressure would deliver more oxygen.
Okay, that sounds like it really makes more sense for a lot of children with autism too. We're going to take a short break right here, but when we come back, I would like to further with this discussion on this piece, because I know that there's some more clarification that could be really beneficial here too, because of course we want to be able to feed oxygen to the brain, and it's interesting how one can do a little bit more than the others here with these hard and soft-sided. So you're listening to Naturally Recovering Autism. I'm your host, Karen Thomas. Stay with us. We will be right back.
Have you ever wondered why some children recover from their symptoms of autism while others never seem to get any better? After 13 years of research, Karen Thomas has recovered her own son from his symptoms of autism naturally. She now shares how she did it with you in her free webinar so that you can have the right resources and knowledge to help your child. The definition of recovery is to regain health. Karen offers this to you in 4 stages: healing the gut, natural heavy metal detoxification, balancing the co-infections of autism, brain support, and repair. Register now for this free webinar to help you know what you can do to help your child to sleep better, be more calm, improve focus, and reach their fullest potential to live a happy, healthy life. Go to naturallyrecoveringautism.com/free workshop, empowering parents with the resources to naturally recover autism from a...
Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we are talking about hyperbaric oxygen chambers and therapy for children with autism. And I wanted to mention that for the show notes, I've created for you a page at naturallyrecoveringautism.com/48, just the numbers 48. So if there are any links that we discussed today, I'll be putting them at that page for you. We have Dr. Anju Usman Singh with us today, who is a specialist in these hyperbaric chambers. And before the last break, we were talking about the differences between hard-sided and soft-sided chambers and the various degrees of oxygen that you can get from each. So, Dr. Singh, what would you say? I guess if you want to explain a little bit further, we had to go into a break, but we've got you were talking about how the more pressure helps saturate and increase oxygen into the plasma and feeds the brain, especially so I'm assuming that these harder chambers would be a better choice for a child with autism. Is that correct?
Well, not necessarily, because when you go to higher pressures and more oxygen, then you can potentially have more side effects and more what we call oxidative stress. So, we're talking about children with autism, and we're talking about children who can't tell us how they're feeling or communicate with us. So, as a physician, I always want to do things kind of in a gradual, thought out manner. And so I usually recommend the soft chambers for our kids. It may take a little longer to get where we need to go. So again, we can talk about protocols a little later, but in my experience with the study that I'll tell you guys about that we did, we used the hyperbaric at 1.3 or soft chamber pressure and got very good results with our kids with autism. And, it's not just about the oxygen, I think. It's about helping the mitochondria work better. It's helping improve oxidative stress. It's helping improve inflammation. It's helping improve perfusion in the brain. And there's even some studies to show that hyperbarics can decrease toxic load of chemicals, pesticides, solvents that might be affecting the brain. So, and then another really potential help with just the hyperbarics is improvement in gut flora.
So it can even improve the gut flora. Is that because you're putting oxygen into anaerobic organisms that aren't wanting oxygen? So it basically puts them in an environment that they don't want to be in. They don't like it, so that they either die or they go away.
Yeah, that's one of the benefits. Many of our kids, you mentioned in your gut recovery protocol. That's number one, right? And
right.
Many of our kids have a lot of anaerobic overgrowth. Sometimes we find markers for Clostridia species in particular. And those Clostridia species can cause a lot of inflammation and a lot of behaviors. And Clostridia is an anaerobic infection. It hates oxygen. So when we add that extra oxygen to that gut, we are able to kind of see that those Clostridia markers come down a little bit. So, that is a benefit. But the other benefit for the hyperbarics in the gut flora is that they've done studies in patients with things like inflammatory bowel disease and colitis, and it helps with inflammation, not just in the brain, but in the gut. and it decreases things like, pro-inflammatory cytokines. And another potential benefit for the gut would be that hyperbaric oxygen can help break down biofilms. And I like to talk a lot about biofilms when we're dealing with patients with chronic infections, like patients with PANS and PANDAS, or chronic co-infections like Lyme or Bartonella.
Yeah, definitely. And I know that if you don't break down the biofilm, I'll link to a piece that on the show notes as well that I wrote on biofilm too, because it's so important. If you don't break down that protective barrier that these organisms create, and even Candida builds this around them, then, people might be doing these protocols and they might be following them properly, but if you can't break down that biofilm, then those organisms are really hard to reach. So this helps. If you can break down that biofilm, you can really break down these organisms that we don't want and help to balance them out and get rid of the excess that's causing the problem. So that's great to know that it does that. And of course in PANS and Lyme as well. For our listeners, PANS is an acronym, but it basically is, when it's called PANDAS, it includes streptococcal infections. Otherwise, it's autoimmune. It's more where your immune system is sort of attacking your body or your brain. So that's kind of in a nutshell there. But I can link to some other episodes as well on some PANS and Lyme shows that we've done, and some pieces for you to get some more information on that as well. So Dr. Singh, I'm wondering too, so you're saying to start for autism, you recommend the soft chambers, and I know that you were talking about maybe we should wait later in the show, or we should follow up a little bit further with some baseline here and then go into, I'm just curious about hard-sided ever being used at all, or if it's better if this just does the job and people don't really need the hard-sided with autism.
Well, like as we mentioned, the higher pressures allow for more of the oxygen to be dissolved into the plasma. So you do get kind of a deeper saturation. And however, the study between the 1.3 and the 1.5, there's not a huge difference. Some people go higher than 1.5, 1.75. And some studies for patients with I would say the medically approved conditions. So things that are medically approved for hyperbarics would be gangrene, these anaerobic infections that we're talking about before, like in the gut or in the skin, carbon dioxide poisoning. The classic would be like decompression sickness, the bends, burns, or severe anemia. In those cases, they do use much higher pressures. Like they go up to 2.2. But when you get above like 2.4 pressure, you really increase a lot of potential for oxygen toxicity. And so, again, with the lower oxygen kind of hyperbaric therapy, you really don't trigger that potential for oxygen toxicity. And that would be a concern, especially in patients with a history of seizures.
Oh, okay. So it could actually trigger something there as well. Okay. We're going to take a short break right here, but when we come back, we'll continue this discussion on hyperbaric oxygen chambers and the importance for autism. You're listening to Naturally Recovering Autism. I'm your host, Karen Thomas. Stay with us. Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we're talking about hyperbaric oxygen therapy for children with autism. And we have Dr. Anju Usman Singh here with us today, who is an expert in hyperbaric oxygen therapy. And Dr. Singh, why don't we talk about, why we've talked about some of the benefits of it in general, but what is HBOT so beneficial for in children with autism?
Yeah, that's a great question. I mean, when we think about autism, none of us really know what causes it. But we do know what some of the underlying metabolic issues we see in our patients are. I mean, they become very evident, and there's a lot of research to point towards things like oxidative stress being an issue and inflammation, especially neuroinflammation and gut inflammation. And then there's also some research to show that there's issues with perfusion, getting enough oxygen to certain parts. So, you know, when we think about things like oxidative stress, you know, I think we think there's too many pro-oxidants in our kids' bodies, and those pro-oxidants can damage DNA and they can damage tissues. And we need to upregulate antioxidants, but the best way to upregulate antioxidants is not just from taking antioxidants, like the classics would be vitamins A, C, and E, CoQ10, things like ALA or glutathione. But another really good way to improve our antioxidants is by upregulating antioxidant enzymes. And so these are enzymes that help to make our antioxidants. And hyperbaric therapy and hyperbaric oxygen therapy has been shown to upregulate these really important antioxidant enzymes like superoxide dismutase or glutathione peroxidase and catalase. So it can improve oxidative stress. What's interesting is if you think about oxygen, you think, oh, oxygen causes oxidation. I mean, that's the whole point of the word oxygen. It causes oxidation and rusting. But they've done some really interesting studies to show that when you're in these chambers, the first hour you get a little burst of what we call reactive oxygen species. You do get a little bit of oxidative stress. And that little bit of oxidative stress is actually beneficial, that short-term burst, because that short-term burst of oxidation actually helps to create some biogenesis or replication of our mitochondria. And that short-term burst also helps to kill bugs. So it helps with infections and chronic infections. But the longer-term effect of hyperbaric, say 24 to 48 hours, what they see is this upregulation of these antioxidant enzymes. So overall, hyperbaric has a antioxidant effect in the body. So that's a huge positive for it, in addition to the oxygenation that we talked about. The other big thing that they've studied with hyperbarics is that it really helps with inflammation. And again, when we think about our kids, we think brain on fire, a lot of stimming, a lot of excitation, a lot of microglial activation, a lot of neuroinflammation. And there are studies to show that hyperbaric helps with these pro-inflammatory cells in the brain, like the big ones are TNF-alpha, tumor necrosis factor alpha, and NF-kappa beta. So hyperbarics can help decrease that inflammation from a global level, from the brain in the body. It also can decrease IgE. So there's some studies to show that helps with things like eczema. And I think another big one, before we get off of the subject, is this concept of lack of perfusion or lack of oxygenation to the brain of some of our children. So for instance, if we did a SPECT scan is a scan that looks at perfusion or how the brain is oxygenating. And if we look at different areas of the brain, what they see in children with autism is that different areas of low perfusion cause different kinds of symptoms. So, for instance, if there's not enough oxygen to a part of the brain that has the amygdala, which is in the basal ganglia, then our kids can't recognize facial expression very well. And it affects their ability to socialize and process emotions. So low oxygen in the amygdala can affect socialization. Low oxygen in this part of the brain called the temporal lobe, it's near our temples. And especially on the left side, it's associated with language delays, especially expressive language delays. So low perfusion in the temporal lobes is associated with lack of communication. It's also associated with OCD and rigidity. And then another big area is the frontal lobe. When we're not getting enough oxygenation into the front part of that cortex, it could affect our processing, our cognition, and our IQ. So hyperbaric therapy can help with tissue perfusion. It increases cerebral perfusion by 75% to 80%. And so it can be very profound for improving those kinds of things, especially if we've done a SPECT scan and we see hypoperfusion and there's not enough oxygen getting to the brain. This type of therapy could be very beneficial.
Yeah, it sounds great for, just in general. I mean, some of these symptoms that a lot of us see in our kids with the language delays and then the IQ and cognition piece. It's not that our kids aren't intelligent. They can be quite smart. I mean, extremely intelligent. But if they're not having enough oxygen to your brain, even you and I have a low oxygen to the brain day or time period, and we can find that we're not able to think clearly. So it sounds like a really simple way to do it. And I know that I'd like to know too, how much of this is necessary for a child. Like, how often do you go to them to get their sessions done, and how long is kind of the general? And it might be like some other therapies where you have an initial phase where you go more regularly for a period of time, and then maybe back off into a maintenance period, or just go sort of as needed after a certain amount of time as well. So I'd like to actually get into that piece of this question, further into the question, the answer to that when we come back. We're going to take a short break right here, but I'd really like to know about that when we come back. So you're listening to Naturally Recovering Autism. I'm your host, Karen Thomas. Stay with us. Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we are talking about hyperbaric oxygen therapy for children with autism, and we have Dr. Anju Usman Singh with us today. And before the break, we were talking a little. I asked a question, and I think it's probably at the peak of everybody's mind of how do we go about bringing our kids into hyperbaric oxygen therapy. And I know that, Dr. Singh, you have some studies that you've, I believe, have you been involved with these studies as well, or you're referring to, but that they are able to help us with knowing what is a kind of a better possibility of a protocol for a child with autism?
Yeah, so I was actually involved in one of the studies. It was published in 2009. If any of you guys want to take a look, it's called Hyperbaric Treatment for Children with Autism, a multi-center randomized double-blind controlled trial. And it was six centers that were involved in the trial, and we had about 70 kids in that particular trial. And we were blinded, and there was a placebo arm of that particular trial. The protocol that we used in the kids with autism was the hyperbaric therapy, 1.3 atmospheres. We used an oxygen concentrator, which increased the oxygen in the chamber to about 24%, and room air is around 20%. So it slightly increased the oxygen in the chamber. Our protocol was 40 hours, and we did a minimum of 5 hours per week. And that 1 hour therapy a day for 5 days a week, and we did 40 hours. We took about 10 to 15 minutes to get them what we call up to pressure, and then 10 to 15 minutes to get them down. So they're usually in the chamber for about an hour and a half. The chambers, because they're not 100% oxygen, you can take things into the soft chamber, like you can take an iPad or your, games. Usually a parent is in there with the child as well. And so it's well tolerated. It's the size of like a small tubular tent, if any of you guys haven't seen them online. And it's pretty comfortable in there. It does get a little warm in there, especially in the summer months. But other than that, it's quite comfortable. It's like going in an airplane. It kind of feels that way, when you take off and land and your ears get a little bit congested. that's how it feels when you're going up or down with the pressure. And overall, what we found with this particular study was that the parents reported overall improvement, and we documented improvement in things like social interaction, eye contact, sensory issues, cognition, cognitive awareness, and receptive language. And as I mentioned, that particular study is published through BMC Pediatrics and PubMed.
Okay,
and there's been
I
some
will.
Subsequent studies. There's also a Thai study, and there's a study in children with autism from Egypt.
Okay, I'll look those up and then and look to link to those in the show notes. And again, the show notes I'll put at naturallyrecoveringautism.com/48. And so social engagement, eye contact, sensory issues, cognitive ability, receptive awareness, language increase. And then you said the parents can go in, and I am always telling the parents to go through the protocol of basically what you take your child through for autism recovery. The parents should go through it as well. Often the parents have many of the same types of health type related issues going on, whether it's candida overgrowth, or they need to heal their gut, or they've got a lot of toxic buildup, or maybe they've got also the some Lyme and strep issues going on themselves. So it's great that the parents can get in and to keep the child company and play in there or do whatever to make it more comfortable, but also being able to get the health benefits themselves, because that's always nice for a parent too. You kind of get two of you taking care of it once.
Yeah, exactly. In our clinic, we actually rent out the chambers for the families to take home.
Oh, they can take them home. Okay.
Yeah, so they can just set them up in their house. Like I said, they're not that big. And it just makes it easier, because it's when I first started doing it, like when we were doing the study, I just found it kind of stressful to go to the doctors every day for an hour and a half for the parents. And a lot of our folks, they don't live close by to our office, and they may have trouble finding a local clinic that does it. So I do think that the rental is a good way of getting these 40 hours in the soft chamber.
And then are you teaching parents how to use it at home? Because I know it's a little bit of something that you need some knowledge behind, as well as how to, like you said, slowly move it up into what level and then to slowly bring it back down. But so you're teaching them this, and then where would somebody, just anywhere, is there a website that we can refer people to look up where they might be able to find one near them, or be either a practitioner or rent something near them?
I think the best website to go to would be the International Hyperbaric Association website. They would have a list of practitioners who do hyperbarics, and they're trained in doing it. And they give conferences a couple of times a year as well. And they would be a good resource for parents who are looking for somebody or a doctor who's knowledgeable in this type of therapy. But to be honest with you, it's pretty simple to do, and it's extremely well tolerated. We can go into a little bit of more of the protocols, and because what I've learned over the last 10 years, so this study that I mentioned to you with the 40 hours at 1.3 was done in 2009. So it's about 10 years ago. And you had mentioned, well, wouldn't 1.5 atmospheres be better? So 1.5 atmospheres is a hard chamber hyperbaric. They pump 100% oxygen into that chamber. You have to go to a facility that has those hard chambers. Obviously, for both of these therapies, you need a doctor's prescription to do them. The protocol with the 1.5 atmospheres of pressure is about the same. It's 40 hours in that hard chamber. So what I've been trying to do for our patients with the soft chamber is leave them in the chamber a little longer, so 2 to 1.5 hours. And I'm aiming for about 60 hours in the soft chamber, so I can kind of get comparable tissue perfusion that I would get with 1.5 atmospheres in the hard chamber without probably the expense of doing that, because it's much more expensive to do the the 100% oxygen.
Okay. It sounds a lot easier for parents too. I know being a parent of a child who once had autism, the constant appointments can be just grueling, trying to get yourself and your child out the door all the time to spend time there. So if this is something you can bring into the home, it sounds great. We're going to take a short break right here. You're listening to Naturally Recovering Autism. I'm your host, Karen Thomas. Stay with us. Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we're talking about hyperbaric oxygen chambers and the benefits for them for children with autism. And Dr. Anju Usman Singh is with us here today, and she's an expert in this field. And we were just talking before the break about some of the differences and the ways to sort of a protocol or how you can use the soft-sided chambers, especially being able to use them at home, which, again, as a parent of a child who once had autism, I know that anything you can do at home or that is made more easily done is a blessing, because it can be pretty challenging at times, and there's always so many appointments you're trying to get to between doctors and therapies and things like that. And this sounds like it's actually pretty relaxing as well. So Dr. Singh, you were talking about your study that you had done, and that was done with 40 hours. But yet, if you send parents home with these rented chambers to bring into their home, the soft-sided ones, that you kind of suggest have them keep it for however many weeks they need, then to get 60 hours in, and then to basically just give them a little bit more?
So when the parents take the soft chamber home with them, they usually rent it for about a month. And I tell them my goal for them is to try to do it every day for the 30 days. And if they can do an hour and a half to 2 hours a day, we can get, 50 to 60 hours in the chamber in that month. And that seems to be a pretty good protocol for most of the patients to be able to do something like that. It is pretty intense because it is daily and it takes a lot of time and energy. So I tell parents, plan for that, because your life is going to be changed a little bit for those, couple hours every day. But most of the parents who rent it do really well. I guess I would mention a few caveats, because, again, doing this for the last 10 years, you kind of learn a few things that maybe aren't in a study. But a couple of things that, before going into something like that, we need to make sure that the kids' ears are okay, because that's probably the biggest side effect. If they have fluid in the middle ear, or they have an ear infection, or they're not good at clearing their ears, there might be some sensitivity in the ears. And I tend to use these Boswellia garlic oil eardrops in the ears, and that really helps a lot to kind of mitigate any kind of ear pressure. We also send them in the chamber with a little bit of a water bottle, but make sure they empty their bladder before they go in the chamber, because that extra pressure always makes you want to pee. Mm-hmm. There are other contraindications. People who've had a history of asthma, or COPD, or emphysema, they are not great candidates for this type of therapy. Any concern for oxygen toxicity. So patients with seizures with the higher oxygen concentrations, we have to be careful. And then over the years, I've learned that if my patients with pandas, as you mentioned, they have these potential chronic strep infections. Strep loves oxygen. So if we're worried about a strep infection somewhere, then we might flare it with the oxygen. And the other thing that likes oxygen is yeast. So I've kind of developed a little protocol for my patients who are diving to kind of cover some bases as well. When they go in the chamber, I like them to be on something for mitochondrial support, because I really feel like the hyperbaric therapy is very beneficial to the mitochondria. And they did some studies to show that if you give a little support to the mitochondria, you can enhance the benefit. So I use a specific mitochondrial supplement that I developed called Mito Rescue. I also cover them with an antifungal, antibacterial, herbal combo. And I cover them just for that yeast and strep kind of issue, just so that doesn't flare while they're in the chamber. And then
So you have
omega-3s would be a good idea as well, just to kind of help that inflammation.
What would be?
Omega-3s.
Oh, omega-3s, yeah. So even though they might have some strep and candida, if you put them on some, again, natural candida type supplements and some mito support, you would still say go ahead and have them go in, even because the benefits are still greater, but you just have to beware of the possibility of candida or strep being triggered a little bit from this.
Yeah. So again, if it's like a rip-roaring candida issue or, an actual strep infection, I'd say let's get over that. Let's address it. Let's get back to baseline. But again, many of you guys know our kids are pretty recurrent with some of these things, and we'll do something and it'll flare them a bit. So when I'm at a baseline with somebody, I'd say, we can use some herbal combination for yeast and bacteria that can kind of keep it at bay so it doesn't flare while we're diving. And I find like usually the kids flare around halfway in, not right away. Halfway in seems to be a little bit of the rocky time. So about 20 hours in, and then, things get much better after that. So, if you see a little bit of up and down, that can happen.
Okay, so you just would want to make sure that you weren't having a really serious candida flare-up, or maybe do some gut healing and candida balancing prior to using hyperbaric oxygen therapy. That would make more sense, correct?
Yeah, and so even if you did it prior, I would still do something during.
Right, okay.
So it's just safer. You're doing it for a month. You're being pretty intense. You're really working on that mito. You're trying to perfuse the tissue. You're trying to work on inflammation. So, and you might even be detoxing in the process of all this, because it does create a little bit of a detox reaction. So whenever we detox, we do kind of, everything has to go through the liver, gets into the gallbladder, it goes through the gut, and then the gut flares again. So just having something on board there. Some of my patients, we even use a little bit of a binder after they die, just to kind of bind up any release of anything that may be affecting them adversely. Yeah,
I'm a huge believer in binders. I think we should all be on them all the time. Yeah. You too?
Mm-hmm.
Yeah, absolutely. It may help stop up some of those toxins as well. And then, so what is the cost of renting one of these for a month in general? I know that probably varies a little bit depending on who you get it from, but what might a parent expect to pay for a month of rental of one of these?
So the heart chamber, the 1.5 at 100% oxygen, is about $200 a dive. The rental is about somewhere between $1,500 to $2,000 for a month.
And then, so when you say $200 a dive, that's per hour, per time for the heart chamber?
Yeah. So,
and then, or you take the soft.
Like 200 times 40.
Right. Okay, so it can add up there too. So actually, the rental is a lot better choice as well. We're going to take a short break right here, and you're listening to Naturally Recovering Autism. Stay with us. We will be right back.
Have you ever wondered why some children recover from their symptoms of autism while others never seem to get any better? After 13 years of research, Karen Thomas has recovered her own son from his symptoms of autism naturally. She now shares how she did it with you in her free webinar so that you can have the right resources and knowledge to help your child. The definition of recovery is to regain health. Karen offers this to you in 4 stages: healing the gut, natural heavy metal detoxification, balancing the co-infections of autism, brain support, and repair. Register now for this free webinar to help you know what you can do to help your child to sleep better, be more calm, improve focus, and reach their fullest potential to live a happy, healthy life. Go to naturallyrecoveringalautism.com/free workshop, empowering parents with the resources to naturally recover autism from a mom who's done it.
Hi there, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and today we've been talking about hyperbaric oxygen therapy with Dr. Anju Usman Singh, an expert in that field. And I've created some show notes for you at naturallyrecoveringautism.com/48. Just the numbers 48. And we've got a link there for you to also be able to find out how to get connected with somebody who has some expertise that is hopefully closer to where you live, where you can learn where you could find a practitioner who has knowledge in this near you, and to be able to possibly rent one and bring one home into your home to use them as well. Because improving for autism, seeing things like social improvement, eye contact, help with sensory issues and cognition, the receptive awareness, and the language issues. And of course, we know our kids have so much inflammation, and it is helpful in reducing inflammation in the body. That is a huge, huge benefit there as well. So I have, again, created show notes for you at naturallyrecoveringautism.com/48. And Dr. Singh, I wanted to ask you do you then suggest, after they've done a month protocol, then is there a maintenance dosage as well? Like you might say, okay, if you start, I know this with like neurofeedback, like you might have your initial protocol, and then a few months later you see a few things maybe slipping back, and maybe you come in for 1 or 2 treatments. Is it the same type of thing with this?
It's similar. The problem is, 1 or 2 treatments probably wouldn't work. It takes a little bit of momentum with this therapy. So this first 40 to 50, 60 hours is kind of where we gauge whether the patients are going to be responders or non-responders. And if they're a responder to this therapy, then we would like to consider repeating it. And again, it varies depending on, how the patients are doing, how they're improving. But usually when we do a maintenance, we would repeat a similar protocol, but instead of doing 40 hours, we would do 20 hours. Some of the parents end up liking the therapy so much that some of them purchase these soft chambers for their home. And then we're able to be a little bit more flexible with the kind of the maintenance schedule. So some of my patients who do really well with hyperbaric, we do 20 hours on and maybe a month off, and then do 20 hours on again, and repeat that based on how they're doing and how they're improving.
Even if they own their own at home, doing 20 hours on and then 20 hours off?
Yeah, taking a break. So it's like, 3 weeks on, a month off, or 3 weeks off. So they do need a little bit of a break in between the kind of intense sessions.
Okay. Yeah, that sounds like a great plan. I know the same with things like far infrared saunas and everything. It's great there's certain things you can have in your home that can be really helpful and make it a lot easier. You don't have to travel or try to take your child or yourself to any appointments, and it can end up being much more cost effective in the long run to do it that way too. Especially like you're saying, if you notice your child is really a great responder to this, and you think it might be something that would be good for you to own, to take that initial investment and be able to put it into something that would become yours in the long term. So is there anything else that you'd like to add before we wrap up? We're almost out of time, but this has been really, really helpful. Thank you so much for being here today. I just want to know, do you have anything else to add, and how can people find you as well?
I'm at truehealthmedical.com. It's on the web. And I also own a pharmacy called Pure Compounding Pharmacy. And I own a supplement company called True Health Natural. So if you guys are interested in any of that, you can take a look online for those. But in terms of hyperbarics, I know that we have to pick and choose which types of therapies we put our energy and our money into for our kids. But in your step 4, when you're talking about repair and helping the body to really kind of heal, I would consider this as a potential.
Okay, so it's really good in the repair phase too, or as well, or best time.
Yeah, I think, once you've worked on the gut, once you've done a little bit of detox, and you've worked on some of these infections, then get that stuff out of the way, throw that oxygen in there, try to really repair that tissue, perfuse the brain. And it's a really a good time to consider hyperbarics. But you can consider it before as well. It's just because of the time and the money commitment, it sometimes, I usually save it for later.
Right, and to get some of those things at bay, get some stability is a good thing too before. So we're out of time. This has been really, really great. Thank you again so much, Dr. Usman. I really appreciate you being here. And you're listening to Naturally Recovering Autism. I'm your host, Karen Thomas. And again, the show notes are at naturallyrecoveringautism.com/